I'm up next, but I don't know where my slides are. But I can get started. What we wanted to have next on the agenda is just a little bit of a segue, moving us into conversations that we hope are happening between researchers and non-researchers. And actually one of the first slides that Colin's here now to pull up is actually and it'll seem weird that I'm starting here, but it's a picture of the Marshfield Clinic in Wisconsin, where I had my first job post PhD. I was a senior researcher at this clinic and went to one of my first grand rounds at the clinic, which had a title, Everything You Need to Know About Research in 45 Minutes. And it was presented by a first-year resident who got up and said, I'm going to tell you, this stuff is not rocket science. I'm going to tell you everything you need to know about epidemiology, biostats, and health services research in 45 minutes. And I'm sitting in the back row going, why did I just spend 6.5 years in graduate school getting 3 different advanced degrees? Because I certainly could have done it much more efficiently, apparently. So what I want to make sure you don't think I'm going to try to do right now is tell you in about 15 minutes everything you need to know about population health research, so we can move an agenda forward. That is not the goal of this at all. So what are the aims here? I just want to present some basic terms and concepts that I hope will inform our discussions about research agendas and how do researchers talk about these kinds of things. And this will be very simplistic. I do want to take a moment to identify some debates that I think there's a lot of kind of petty academic debates, and there's a lot of debates that really matter. And Nancy did just a beautiful job of taking us through some incredibly important scientific debates through history that have mattered tremendously. And I just want to signal some of them, and I think could enter some of our discussions. And then quickly, I want to present a framework for us thinking about what are our research priorities in the field of population health, but in a context that has us also think about action at the same time. So really simply, I just kind of want to go through these 3 things that researchers, this is how we think about going about doing our work. And the first thing is the important point, research questions drive everything about research. And that is, what is the purpose of doing the research? What is it you want to know? What is it you want to find out? Different disciplines think about research questions in different ways. They kind of have different typologies and put them in different buckets, but a lot of disciplines, and especially social science disciplines, tend to think about, well, we have 3 major buckets or types of research questions. First of all, we have exploratory ones, and those are more when you have kind of initial hypotheses about something, or you really, I want to understand how the world works. We don't know much about it yet. I really want to explore some ideas in this kind of a new topic area, or new way of thinking about something. Another type is descriptive research, and here's where we want more data, we want more information that's going to help us better understand, get a deeper picture of some phenomenon, trends, patterns, etc. Explanatory research is where you're really doing the work because you want to understand causal relationships. Does X cause Y? If we intervene in some way, is something going to happen? So here's a few quick examples. Exploratory research, one of many, many examples in the field of public health is there's a lot of attention around housing right now. Well, how might having more stable housing in certain populations improve quality of life among a number of dimensions? Couple of examples of descriptive research. What are adolescents' most trusted sources of health information? Or what are historical trends and patterns in prescription drug abuse? Explanatory research questions, again, are ones that try to get at causal relationships. How does chronic social stress increase cardiovascular disease risk? Or will attacks on sugar-sweetened beverages actually reduce obesity? So once we have our research questions in place, then we have to think about, okay, how are we going to go about answering those research questions? And that's what a research design is. It's the overall design or architecture of a plan for answering the research questions. Here's some of the basic components of a research design. First of all, you better be pretty clear about what's your purpose. Are you exploring? Are you trying to just describe something? Or are you trying to explain relationships? What's the topic? In public health and population health research, we need to be really clear about what are we focusing on here and at what unit. Are we thinking about some phenomenon that just occurs among individuals at the micro level? Are we at the meso level where we're thinking about phenomena that happens at neighborhoods, at the organizational level, within families? Or are we at the macro level where we're thinking really about population level phenomenon? There's time dimension and comparisons. Research designs are where you're gonna, am I gonna be able to answer my research question with or without making comparisons in people or groups or, phenomenon over time, comparing things with themselves over time or comparing across groups. It's when we're in the world of causal inference, it's when we're really trying to explain causal relationships that we need a really strong research design. And of course, the randomized trial or experimental designs are what science holds up as the coin of the realm for really getting at causal relationships. We have in population health, and certainly in my world, in the policy world, really not going to be randomly assigning different different groups to different laws at different states. That doesn't happen, but we can kind of get close to that through natural experiments. We have a whole bucket of quasi-experimental designs. And again, my point today is not to take you through what are all these designs, what are their strengths and their weaknesses in terms of internal and external validity, the way researchers talk about this, but just make the point that different designs are more appropriate for different kinds of research questions. And when we are getting at causation, we're in the realm of these kinds of designs. And I also want to make the point, if we're asking questions about cost benefit, cost effectiveness of different kinds of interventions, we are definitely in this realm of explaining, because you can't say, what is the worth of an investment in something unless you know what the impact of that was. So again, we're in the explanatory realm there. So within a research design, then we have what is called methods. So again, within the context of the design. And methods are ways in which the data, the information to answer your questions will be obtained first of all, and then analyzed. Research design and methods are both important. You can have a perfectly constructed randomized trial, looks beautiful from a design point of view. If you have, excuse the technical term, really crappy data, it doesn't matter that you had a great design. Vice versa, you can have beautiful data on something, but a bad design. So both these things are very important. Getting data, researchers talk about primary data. That means when you have to go out yourself and collect new data, there isn't information, data out there that already exists, or sometimes you can use secondary data. That's when data are already out there. We can use data from surveys, administrative systems, the census, et cetera. And then analyzing data, this whole fields of people specialize in what are the appropriate ways to take that information and analyze them, analyze the data to get at your questions. Sayer's law: in a dispute, the intensity of feeling is disproportionate to the value of issues at stake, and that's a well-worn joke about in academics, the academic politics are so intense because the stakes are so low. I actually don't agree with this, and certainly not after I couldn't help myself. I spent over 2 hours last night in my hotel room watching the Planned Parenthood hearings on C-SPAN. Very intense debate, and the stakes are incredibly high. So this isn't always the case. But I will say there are some debates in academia that people outside don't totally understand. But I think there are some that are relevant to the work we want to do together moving forward. There's a lot of debates about definitions, and they're important. What's a population? What's population health? Nancy has a beautiful paper on the history of how we've thought about and defined population, so I urge you to read that. What's community? Who gets to define community? Debates about how not only we measure, but how do we define socioeconomic status or socioeconomic position? Race. Over time, within the same country, our country, we've defined race differently, and certainly across different cultures and societies, we look at race differently, and then again, health. There are debates about definitions, and they're important. Also, there's some people who feel if it can't be counted, it doesn't count. So I will say, since I got trained, the quantitative versus qualitative methods debate has subsided a lot. And there's a tremendous growth, as there should indeed have been, in the recognition of the contributions of qualitative data and insights and mixed methods. But I think a lot of debates still are out there, and especially when people are trying to bring qualitative research that's making causal claims. That's where most of the tension, in my experience, has been. And that leads us also to then some disciplinary differences. Now, disciplines, population science by definition is not only interdisciplinary, it should be transdisciplinary, and not just parallel play of different disciplines. It should be bringing different perspectives together to develop new understanding, new theories, and new methods. And so population health requires this of us. But disciplines are important, and disciplines do go very deep in their theoretical perspectives and frameworks and methods. Just gonna let you know about a little debate that was that I was part of last month on Twitter, and can you really have meaningful discourse in 140 characters? I don't think so, but this is just illustrative. So I don't know if some of you saw a study came out in late August about, in the headline, I saw many different headlines, but it was from the nurses' longitudinal study that showed a relationship between the number of hours that women worked and their risk of reporting that it took them longer to get pregnant, or they were having difficulties getting pregnant. So some of the headlines came up like, hardworking women, women have to choose between babies and work, or, long work hours, reduced fertility, or, So Amitabh Chandra, who is pretty well-known health economist and healthcare policy expert from Harvard tweets, latest garbage from epidemiology, women who work more can't get pregnant. And I recently seen comments like this and heard comments like this from my economist friends who are sort of discounting epidemiology, and I've been trying to engage colleagues who do work on housing and economists who do work on housing and transportation and the upstream social determinants of health to come to population health, and I was getting some pushback like, I don't know, this social epidemiology crap. So Amitabh was not the only voice in the field like this. So again, I'm new to Twitter. Honestly, I don't really know what I'm doing, but I know Amitabh, and this was like early in the morning. I'm like, oh, for God's sake. So I tweet back, not defending steady or ridiculous headlines, because I think they were, but I'm noticing a recent rant against all epidemiology by economists. Why? 6 seconds later, because epidemiology, with few exceptions, is a train wreck, weak designs, ideological, and consequently irrelevant. And at that point, I'm just really mad at this point. And then Sue Donarski, who's a new colleague of mine in the same school of public policy I'm in, at Michigan, does incredibly important education policy work. I respect it very much. She writes bad epi studies like this crowd news. PR offices at journals, universities drive the hype, but professors are complicit, as the quote in this article shows, and the quote from the lead researcher on this article basically did, I agree, overstated the findings of the study. And then Amar Hamoudi, who was here yesterday, who's an economist, writes, not all epi, not all economists. He's trying to be the voice of reason in that. There was some more exchange in this. And again, I'm only showing this as an example of some of the debates that happen across disciplines that absolutely need to work together and talk to each other if we're going to advance the field. So I think the comments do reveal a number of things. There are some issues with media coverage and the translation of research findings to, we were just talking about that in the Q&A, research findings to the public. Also reflects some disciplinary differences in research design and methods. And again, it's all in this realm of causation. Does working long hours for women cause them, to have problems with fertility? That particular study actually didn't control for the amount of sex that women were having. So that was if you work a lot of hours, I think that was one of the major concerns with that interesting study. But again, I think that's where the debate is. When do we have information that is interesting, might be suggestive of relationships, but how do we establish causation? It's very difficult, and economists, by their training, want us to be extremely careful about that. So what's needed? I think we need new and better research in a lot of areas. We need new exploratory research. We need better understanding of population health phenomenon. And we need better evidence of policies and interventions that work, and also the ones that don't work and we should move on from. We also know that there's a lot of research out there that already exists. We've answered some of these questions. We have a pretty good understanding of a lot of issues related to health inequities, related to population health. And the problem is that it's either not known, it's not used, or politically, it's strategically ignored. So how do we improve the translation and dissemination of the science that's needed out there? And that gets into the field of translational science, which is research to better understand how we can improve research translation and dissemination. And here I just think about my Uncle Bud, who always said to me, "Oh, you're a professor, those who can't do teach." And to try to explain to him what translates. So researchers have to do research about research. But yes, Uncle Bud, they do. All right, so last little thing to leave you with before the break, and we will take our break on time. Wanted to put to you a framework for, as we, again, move to try to identify some priorities in a large space of a research agenda for population health, how we might go about thinking about this. And I would suggest that one thing we want to do is think about, well, what's the current state of evidence or knowledge out there, and do we have consensus around that? And where do we think it's strong? Where do we think it's, we're moving in the right direction, but there's still some answered questions? And then where do we really need focus? Where do we not have the evidence or really consensus from perhaps exploratory research about what we think is going on in different types of population health phenomenon? But at the same time, I would like us to think about, okay, and then what is the current state of evidence-based action? Evidence-informed policy, evidence-based policy. Where is that strong? Where do we need to do a little more work? And then where is it weak? So here, up in the top right-hand corner, I would say here, do we have, and there's debates about, you might quibble with where I put anything in this chart, and that's fine. These are just for illustrative points. But I personally think we have really good science on climate change, and we're weak on what to do about it, and that's very political. Also, gun violence. No one can deny that the amount and types of gun violence in the United States is very different from any other country. We can define that as a public health problem. To have policy, intervention, action on that, we're weak on that. What can we do about that? I put in that box as well the issue of DARE, the Drug Abuse Resistance Education Program. I think that's an example of where the evidence and consensus that program did not work was extremely strong. And I say it was evidence-based action was weak because that program was in 75% of elementary schools at one time in this country, even though the evidence suggested that program didn't work. So we can have issues in that particular box that are very different sets of circumstances. But one area of priority for research might be in that bottom right-hand corner. So where do we just not have, we don't have the evidence, we don't have the science on a particular issue, and thus we don't really know where to go with policy and practice. That could be an area where we might say we want to prioritize for research. But again, there's lots of other boxes that we could be in. I personally couldn't think of any examples where we had good evidence-based action where we have weak evidence. I think by definition that probably doesn't exist. Again, this afternoon, we will be sitting at tables and discussing whether or not we think we can set some priorities for a research agenda, and the planning committee for this workshop just offers this framework to you as a way to maybe think about, where do we need more evidence, but in this context, again, of we don't want to just be producing science for the sake of science. We want to be doing that in the context of thinking about how can we move forward in changing policy and practice and structural, as Nancy eloquently described this morning, the structured chance of people and how that plays out over their life course and produces health and health disparities. So, what do we want? Evidence-based change. When do we want it? After peer review. That takes too long. It's an important part of it, but we need to move on action very quickly as well. So thank you. It is time for the break. I'm happy to entertain any questions during the break, and I do want to keep us on time. So thanks for your attention, and see you back here in 15 minutes. Thank you.